skin off with like a surgical prep type solution. Because we want it dry and clean for when we measure your face. And this doesn't hurt at all, it just beeps. So here we go.
And what are you doing this for?
This is letting the machine know the surface area we're going to treat. So it calibrates it with the rest of the settings.
So how many different positions do you have to scan?
You have to do the cheeks, the nose, and the forehead. So here we go, 1, 2, 3. How's that feel?
Fine. The air kind of tickles.
Well, by taking those measurements, then it bases all of the measurements of each person's, face, which everybody's different, obviously, and then it delivers the same amount of energy and coverage into each area. So it makes for a very even, smart treatment. So there was that. So 25.
That's good.
Okay.
So what does it feel like, Kathy?
This isn't bad. Like my side that's done feels really tight.
I mean, there's an ablative wavelength and a non-ablative wavelength. So they're coming out simultaneously, so the patient gets both at the same time, an ablative and a non-ablative.
So you get like 2 treatments in one?
Basically, 2 treatments in one. And the downtime is like 4 to 5 days. So it's little downtime for a treatment that you're getting basically kind of double what other, treatments or lasers can offer, because you've got the 2 different wavelengths coming out at the same time.
So you talked about pinpoint bleeding. Why does that occur on some people, or what? Is it just skin type?
Skin type, or some people, if they're very fair skinned, or if they're very thin skinned, or if they take a lot of aspirin or fish oil.
I take all of those.
Yeah. And obviously the more aggressive treatment that you do, the more you would have an instance of the pinpoint bleeding than the lighter treatments.
So how long do treatments usually take?
Usually about half an hour. I mean, you have to numb for 45 minutes or an hour prior, but then the actual treatment time is pretty quick once you get going.
So this is the final section, the nose.
Yes.
It goes faster on the nose with less surface area.
This isn't bad. So now you're going to treat her neck as well.
Correct.
So you're cleaning it.
Yes.
So how does this feel, Kathy?
Neck's fine.
So the treatment's complete, and it took.
30 minutes.
So now what are you going to be doing?
So now we are going to spritz her with some spring water, and then when she's ready, we will put some lotion on her face.
And that
Just
will just.
help cool her off.
And then I'm going back to work.
And then she's going back to just applying
Oh, it feels good.
a cream to her face just to cool her skin down and soothe her skin a little bit. And this is the cream that she'll be using for the next 4 to 5 days with her sunscreen. So this is nice because it's not like a petroleum-based cream, so it's not real goopy and oily. It's not gonna clog her pores.